pada chat room. Jadi nantinya hadir tersebut silakan Bapak dan Ibu klik dan isi sesuai dengan apa yang ingin Bapak Ibu isi, nama dengan tulisan yang tepat, karena sertifikat langsung akan Bapak Ibu terima setelah Bapak Ibu mengisinya, jadi tidak menunggu sampai besok. Namun kami tidak memperbaiki ejaan dan sebagainya, jadi mohon untuk menuliskan sesuai dengan yang Bapak Ibu ingin tertera pada sertifikat. Our final speaker is Mr. Silverio de Sousa Mendes, a Chief Business Officer, MBA Sales and Marketing of Take the Win SA Body Interact Incorporation. He's also an executive member of the Corporate Roundtable of the American Society for Simulation in Healthcare, USA. Mr. Mendes has an impressive achievement in digital media, has won many remarkable awards in the field. He has been having a keen interest and passion in developing especially in developing digital technology, particularly used in medical education and training. Such interest is aligned with the commitment of the Take the Win, a company working in developing and providing technology solutions and digital content for medical education since 2008. So it has been 12 years. Mr. Mendes adalah seorang Chief Officer dari Body Interact Incorporation yang sejak tahun 2008 berkomitmen dalam mengembangkan dan menyediakan perangkat digital untuk keperluan pendidikan dan training dalam bidang kedokteran. Ladies and gentlemen, please welcome Mr. Silverio de Sousa Mendes. Mr. Mendes, you have 20 minutes.
Thank you very much. Selamat sore. Unfortunately, I cannot speak many more words. For me, it is a pleasure to being part of this conference, and it is also a pleasure to be in touch with all of you. We know that we live very challenging times right now, but we need to keep giving the classes to the life science students, for example, and to all the other students also. But we know that we live many challenging times this year. But we are helping the medical schools, the nursing schools, the teaching hospitals, the medical societies, and so on, all over the world, to give them the possibility to keep giving the classes remotely, to keep giving the practical classes also remotely. I will share a small video just only to make an introduction. After I will go by some slides. After we will go all together making a clinical scenario with a virtual patient, because we already know that the real patients are better than the virtual patients, but sometimes we need to access to the virtual patients because the safety part and the casuistic is also different every time that we are accessing with the virtual patients. So I will share right now the screen, a very short introductory movie. Here it was to give you the idea about how the people react to the Body Interact. The people are happy when they are using the Body Interact, the teachers and also the students. The central part of the Body Interact are the teachers, because without the teachers, the Body Interact cannot be useful. And the Body Interact, it is an innovative didactic approach. It improves the decision making. It improves also the soft skills. It accelerates also the critical thinking using an emotional engagement in a real-time feedback, and it is, without doubt, a confidence booster. we have been making many research papers and all over the world, and all of the conclusions goes in this direction, and goes also in another direction, because the body tract is considered also as a learning accelerator, a learner accelerator for medical and nursing education, and a learning accelerator that all the people can benefit using this kind of tools. We typically use all the people around this big multi-touch table with a life-size real patient, but right now, due to the COVID-19, we are making a different approach, because we are making the distance learning environment, where the teacher can give the clinical scenarios synchronous or asynchronous to each student. The body tract already received some recognitions. We received already the prize in 2016, the Best Product Show Award in the IMSH event in the American Society for Simulation. Recently, we also won a World Summit Awards, that is a prize related to the e-learning products that can be used and can also give benefits to all the community regarding the healthcare area. We won also a prize in the recognition from the United Nations. We also work very, very close with the top medical societies of the world, like, for example, the American Heart Association and many, many others. We also have partnerships at a national level, but this I would like to underline, the global partnerships, because they also review the body tract product, they also review the algorithm, they also review some clinical scenarios. The body tract is useful and it works in two different areas. It works on the area of the pre-graduate education. The main purpose are on the medical and nursing schools, but it also has been very useful on the professional development, on the live events previous than COVID-19, and also on the learning projects that we are keep doing with many, many, many medical societies, many medical and nursing schools. The targets that we serve, there are the medical schools, the nursing schools, the training hospitals, the first responders, the stimulation centers, and also the high schools, and we also have on board the certification providers. I would like to share with you regarding the simulation centers, because in our idea, the simulation centers are a building with 4 walls, and nothing related to the simulation can go outside the simulation center. But with the body tract, it is a little bit different, because the body tract can be used inside the simulation center, but can also go outside the simulation center to a classroom, can go outside the simulation center, for example, to the house of the teacher and to the house of the student. And we cannot compare, for example, with the mannequins and also with the test trainers. Unfortunately, or fortunately, we cannot give them the possibility to give to the students to take a mannequin to their home, to take a test trainer to their home, because it will be not possible. The only way that it's possible to make this distance learning environment, making the practical sessions and not just only the theoretical sessions, it is using also the body tract. On body tract, we have a physiological algorithm that we have been working in this physiological algorithm for 10 years, and it is an algorithm that is very, very, very close to the real world. We have just only one physiological algorithm for all therapeutic areas that we are covering right now. We are covering right now 18 therapeutic areas, and in this physiological algorithm, we have more than 60 interventions, more than 150 medical tests, more than 300 health conditions, and more than 300 medications. These numbers are day to day, they are increasing, and these are the areas that we are now covering. And once the body tract algorithm, it is just only one for all of these therapeutic areas, let me underline to you that if we are dealing with a patient in a cardiology field, and if we administrate something for the respiratory area, as in the real life, it will also impact the patient health conditions to the patient. So the experience is very, very, very close the real world. That's why also all the medical societies also trust in this product, and that's why also 45 countries all over the world also trust in this Body Interact product, because in this way they can keep giving the classes remotely in a practical way, because it is not so difficult giving the classes online in a theoretical way, but it's very hard when we as educators we need to give the classrooms in a practical way in this distance learning. But with the Body Interact it is possible. But a picture is better than a thousand of words, and I would like to invite you right now to solve with me a clinical scenario with a virtual patient. I will select a very simple clinical scenario just only to demonstrate how it works, and just only to demonstrate how it arises our adrenaline. Because another benefit that all the research studies also give us, it is that with the Body Interact we feel the real pressure of the real world, and we feel the pressure of the need to save a life, because the time is running. We have the beep beeps from the simulation, we have facial expressions from the virtual patient, and so on. Yeah, I believe that it will be a huge experience. Right now I will be making alone, but me and Java Medical will also invite you to register in a website that you can also use a couple of clinical scenarios for free. And in this website you can also give the access to the students, for example, and you can try if they like it or if they did not like it. These specific clinical scenarios, we have simulations just only regarding the COVID-19 clinical scenarios, and we are always updating these clinical scenarios. So I will call the first virtual patient of today's, that is Victor Jensen. It will start with a briefing from the nurse, and let me also underline to you that on Body Interact we have a proportional time. 20 minutes on Body Interact are more or less 1 hour in real life. So it means that all the times will run 3 times more faster. It means that if we ask an EKG, for example, it will appear in 10 seconds. If we ask biochemistry, it will appear in 45 seconds. So we try to keep this proportional time. Let's listen to the briefing from the nurse.
Male, in his 50s, was found collapsed in his office. He has regained consciousness, but he keeps complaining that he is not feeling well. This is the first time he has been admitted to the ER, so no medical records can be found.
So here we have some information that is relevant and some other information that is not relevant. So they are taking the patient right now to the emergency room, and in a couple of moments we will
I'm feeling really tired.
There's not a predefined way to approach the patient. If we would like, we can start giving medication. If we would like, we can start making interventions. We can start making questions and so on. My preference is starting seeing the visual signs of the patient, because the visual signs of the patient are also connected to the algorithm. Here we can see that the patient is sweating a little bit, is a little bit tired because the eyes are not so open, and a little bit pallid. The chest movements they are normal, and the low members, they are also normal. We can go forward making some questions, and although the questions are the same all over the clinical scenario, the questions will be the same, the answers will be different according to the patient health conditions. So it means that if we are performing with very good decisions, the patient health conditions goes better. If we are performing with very bad decisions, the patient health conditions will deteriorate. In these specific questions that are pre-programmed, there are also questions that are first priority that we need to ask. There are questions that are second priority that is not so relevant to ask. And there are many other questions that does not make any sense to ask. But at the final, we will also see how we have performed, and what were the items that we made as first priority, as second priority, or not relevant. So right now, I will ask regarding the medical condition, how is he feeling?
I'm feeling weak.
I will ask, is feeling any pain?
No, I'm feeling no pain.
I will probably ask regarding the medication, what he's taking.
I'm taking this Gleeman, Damine once every day, and I'm also taking aspirin, also once every day.
And I will ask another question that probably does not make sense. How much he walks each day?
I haven't been walking much, no.
So we can also make the physical exam in the ABCD approach, that we can check the airway, for example. We can see that the airway is open, not obstructed, and no upper abdominal.
I'm feeling
noise.
really tight.
We can also go forward, for example, making the pulmonary auscultation. I can drive the stethoscope, and I can listen to different sounds. I can also make the chest percussion, that I will touch these predefined hotspots, and I will listen feedback based on sound. And I can also make these chest palpation, that are predefined hotspots that I will touch, and I will receive the feedback of the patient. We can make it for the circulation. We can make it for the disability. For example, if we want, we can also make the pupil light reflex, and we can see if the pupil is reacting or not to the light. And according to different clinical scenarios, we will also have available many other ABCD approach examinations to make it. For example, if we are dealing with a pregnant woman, the exams will be different. If we are dealing, for example, with trauma scenarios, the exams will be different. With the pediatrics, the exams will be different, and so on. Every time that we will go to the ABCD approach, the exams could be different. Now we can start monitoring the patient, for example, and we can see that the temperature, it is okay. The blood pressure is a little bit higher, but I believe that it's not the main problem right now. Here we have a 2-lead ECG, but if you would like, we can order a
Just a
12-lead
moment.
ECG.
Here is the ECG.
In the meantime, I will also order a
A
biochemistry.
full biochemistry has been requested to the lab.
The exams will arrive. We can see that the patient is in sinus rhythm, but I can also call a report that gives me the idea about that the 12-lead ECG, the patient is in sinus rhythm.
I'm feeling really
Every
tight.
exam that we will request, it will be available. For example, if I order
A chest CT scan has been
it's
ordered.
not an exam that is connected to this specific clinical scenario, but it will be also available. So, as in a real life, all the things that we will request, it will be available. But at the final, we can also probably receive some penalties. Regarding the lab tests, every exam that is signalized with red, every time that is signalized with red, you can also see that are outside the reference interval. And with this patient, the problem is the blood glucose that is lower. Here we have received also this exam. We can also see the report and so on. But we can also not lose our focus. And our focus will be improve the blood sugar on the patient. I can also make interventions. I will put, for example, I can also put here a catheter, for example. I will put a catheter, preferring
Inserting
catheter.
catheter.
But it is just only to work the clinical reasoning. It's not to train the procedure, but to work the clinical reasoning. And now, in order to demonstrate how the algorithm happens, I know that I need
I'm
to
feeling
sugar,
really tight.
but I will make a mistake. I will give insulin, and I will give intravenous bolus, for example, and I will give 6 units of insulin. Okay, you can punish me because I will probably kill the patient. If you see the patient is not conscious, is not blinking the eyes, if we try to talk with him, he will not answer us. And now the patient comes. So we need to start making the advanced life support.
Applying
Let's
chest
make
compressions.
the manual compressions. let's
Proceeding to
connect also
intubate.
the ventilator, and let's
Done.
also
Turning on
give
ventilator.
a little bit 1 milligram of adrenaline. So if you see the blood sugar decreased a lot, so we are in a hypoglycemia, and right now we are in a worst hypoglycemia, and we are now making the advanced life support, making the compressions, making with the ventilator, although the patient is cyanotic, because if we see right now the fingers and all the extremities are in blue, so all this is connected. Now the patient is back to life, and we can have strategies. For example, the blood pressure is a little bit low, and I believe that we can also improve the blood pressure making crystalloids infusion 2 liters. And I believe that soon the blood pressure will start going up. In the meantime, the blood sugar is 34 milligrams by deciliter, and we can also improve giving. I will also go to the fluids. There's many possibilities to treat. I will go to the fluids and I will give 100 milliliters. Every time that you would like, you can also see what have you been doing all over the clinical scenario. You can see the 12 lead ECG. You can also see the biochemistry that we ordered in the past. We can make everything. If you see right now, the blood sugar increased a lot. So right now it is upper than expected. That's why I will give 2 units of insulin in order to control, because as in real life we can also adjust the dosage. If we see they are administrating right now, and it will start making effect just only right now. If you see the blood pressure, we are making a very good job, because the parameters are increasing. The oxygen saturation is also increasing. Let me check. The blood sugar, it's a little bit below the reference interval. We can also order, for example, another
A full
biochemistry.
biochemistry has been requested to the lab.
We already know that once the highest parameters is 110, probably we need to give more insulin. But all the other items are keep improving, and I will give just for another 1 unit of insulin in order to have the possibility to decrease a little bit. I believe that it will appear right now the biochemistry, and we can compare. For example, the previous biochemistry have these results on the right side, and the actual biochemistry have these results on the left side. So we can also compare, and we can also discuss what will be the next good approach to the patient. The blood sugar right now decreased to the parameters that we want, because we want 110 and we have it 117, so we are almost there. And I believe that we can also make some other interventions. For example, I will raise the bed 45 degrees, because I believe that it will also help the oxygen saturation to increase once we are raising the bed 45 degrees. In the meantime, once the oxygen saturation is 89, I believe that I can also change to a high flow mask.
1 minute.
And
High flow mask in place.
right now, the high flow mask is available. The oxygen saturation is keeping improving, and I believe that in a couple of moments, the patient now is blinking the eyes, if you see, and I will ask the same previous question: how is he feeling?
I'm feeling better
And
now.
he's feeling better now. So it means that we have very good decisions on the side of our healthcare professionals, and now we have the message telling that we meet the guidelines, and we can go to the debriefing. In the debriefing, there's a first question that we will ask that was an hypoglycemia, and the answer was right. And here, for example, if you decide to give the possibility to the students make the scenario alone at home, they will just only have access to this question. They will perform the clinical scenario, they will give the diagnosis, but they will not see the debriefing tools. But once we are now with a teacher profile, we can also see these debriefing tools. If the student does not will see it at home, the teacher will receive in the learning management system the full detail of the debriefing. And here, in a very fast way, I will promise, I will show you how it works. For example, we have a global score. We have the physical examination that I missed to check, for example, the pulse palpation, the capillary fill time that are first priority, and I made also the urinary output that is not a priority in this specific clinical scenario. I already know that I need also to improve a little bit the dialogues with the patient. There's this question as expected, how much he walks each day does not make any sense, but you can see I asked one question regarding second priority and two questions regarding first priority. So I already know that I need to improve a lot in this specific area about the dialogues. I can also see that I applied 10 different competencies regarding the knowledge area in this specific clinical scenario. I check the airway management, I make the pupillary examination, I made the oximetry interpretation, and so on. We can also see the whole timeline of the simulation and what was the impact of our decisions in the untreated conditions of the patient. And we can always understand why and how, because we can also see again the exams and discuss if made sense or not. Request the exam, is this exam, but we can also understand, for example, how and why the patient coded. The vital signs are 0. In previous, the vital signs are pretty healthy. Just only the blood glucose was orange. And we can understand that the patient entered in cardiac arrest because I gave 6 units of insulin. So there's always a problem. Here, at the final, we solved the clinical scenario, although the patient was in a hypokalemia because the blood sugar rate is a little bit higher than expected. We can also see what are the reference that the scenario was based, and if the teacher wants, the teacher can also have some resources, and in this way they can also put PDF documents, PowerPoint documents, movies explaining the physiology of the pathology, the guidelines, and so on. This is also a main goal because the teacher can design the learning experience for the student. The teacher can put every other resources that the student needs also to check it after making the clinical scenario. I would like to share with you also, I'm just finishing, I promise. We have a built-in learning management system that allows you to combine a hybrid experience, a hybrid learning experience for the student and also for the teacher. Because we can combine the live classroom and also with the distance learning. And in the distance learning, the teachers also have access to the learning management system of the body tract that they can track the student's activity all over the body tract. They can program, for example, that today from 5 o'clock in the afternoon until 7 o'clock in the afternoon, the students, this group of 13 students will have access to these 2 clinical scenarios to solve, and another teacher at the same time can give to 100 students at the same time 4 different clinical scenarios to solve. And the teachers will also receive each performance of each one student. And they can also download an Excel file that they can also work all of this data, or they can also download a PDF document that they can also see the whole timeline report of each student, for example. As promised, we would like also to invite you to register in this website, covid19.bodytrack.com, because in this website you have a couple of scenarios for free that you can also explore by your own or also with your students in order to check also their feedbacks from this new way to learn. So we need to keep giving the classes to the students. We cannot stop and we cannot give the power to the pandemic to block worldwide all the activities with the students. And we strong believe that we will help you in Indonesia. Also, we will help you to keep giving all the classes to all the students in these life areas, life science areas. Sorry, in order to give them the possibility to make it a really distance online learning experience. And it will be a very good experience also for the teacher, but it also a very an amazing experience also for the students. Terima kasih. And I will be able to answer all the questions that you would like to put to me and to all the other colleagues for the panel. It was a pleasure for me be in touch with you these moments.
Thank you, Mr. Mendes. There is absolutely an eye-opening experience on how technology can be developed as such that students can gain maximum experience regardless. Of course, the real experience with real patients in real setting is incomparable,
Yes,
but still, this is very sophisticated. I had a feeling that I was watching an episode of Grey's Anatomy.
Thank you very much.
Bapak dan Ibu, demikianlah ketiga pembicara kita telah menyampaikan materi mereka. Dapat kami informasikan bahwa sebentar lagi kami akan menayangkan daftar hadir pada chat room. Ini tibalah kita pada sesi tanya jawab. Beberapa pertanyaan telah kami terima di Q&A room. Now that we are in the discussion session, we have received many questions from attendees in the Q&A room. We are hoping that each speaker can choose up to 3 questions to answer directly in the session. I mean orally. However, you can also give written reply in the Q&A room. But we'd like to suggest that you pick 3 questions that you find most interesting to answer orally so that all participants can follow. I think we can start from Dr. Doni. Dr. Doni, can you please pick 3 questions to answer directly in the discussion session so that everyone can follow you?
Oke. Ini kok video saya nggak keluar, nggak tahu kenapa ya. Tapi suara saya bisa didengarkan ya?
Bisa. Jelas, Mas.
Saya di depan kamera tapi nggak kedetek sama kameranya. Oke.
Saya pikir tadi di balik pintu itu, Mas.
Mungkin ya. Ya udahlah. Bentar ya. Jadi tadi ada satu pertanyaan yang menarik mengenai
mungkin, Mas.
Jadi mengenai assessment ya untuk tenaga medis di era pandemi. Tadi banyak sekali yang tanya, jadi saya pilih satu ini. Jadi di era non pandemi, era normal, kita kan memang menggunakan OSCE ya untuk ujian keterampilan medis. Tapi kita harus tahu bahwa konsep dasar dari ujian keterampilan medis itu adalah observation based test. Jadi bagaimana kita diobservasi ya, diuji ya, tapi di situ nanti kita bisa menggunakan media yang ada untuk bisa mengobservasi keterampilan mahasiswa tadi. Untuk itu menurut saya yang penting kita harus perhitungkan di sini adalah kalau kita mau menggunakan online untuk ujian keterampilan medis, berarti kita tetap harus menggunakan prinsip observation based test. Jadi kita harus melihat performa mahasiswa, kemudian memberikan nilai atau memberikan feedback di situ. Nah, di sini keluar ya gambar, walaupun kurang jelas. Ya. Di sini kita harus memperhitungkan nanti video itu nanti observation itu mau menunjukkan apa, itu yang utama. Jadi apa yang harus diperhitungkan di situ adalah kriteria dalam memvideo ketika kita menilai. Jadi ketika mereka diminta untuk memasang infus, misalnya di manekin gitu, nah nanti memvideonya itu angle mana yang harus jelas, mana yang harus di zoom. Nah asal kita kriteria yang tadi sudah jelas, saya rasa tidak masalah. Jadi itu yang menurut saya harus kita perhitungkan kalau menggunakan OSCE, menggunakan online. Nah, kita bisa menggunakan live videonya dan juga bisa sinkron, jadi bisa direkam, kemudian dikirim ke penilai, nanti mereka memberikan feedback dan memberikan nilainya. Jadi memang kalau kita lihat di sini memang masih banyak kekurangan dibanding offline, tapi tetap menurut saya karena era pandemi ini semuanya darurat ya, jadi itu bisa kita menggunakan media video recording. Itu aja dari saya Mbak Emma untuk satu dulu, mungkin selanjutnya yang lain. Silakan.
Baik, terima kasih Dr. Doni. Memang pertanyaan mengenai assessment ini karena harus berlangsung secara jarak jauh juga ya, tentunya banyak hambatannya karena bagaimana kita sebagai pembimbing bisa mengetahui apakah mahasiswa melakukan dengan diharapkan ya dan sebagainya. Ada pertanyaan terkait dengan kurikulum, Mas, perubahan kurikulum pada masa pandemi ini dengan penggunaan teknologi yang berbagai inovasi ini, apakah perlu disusun kurikulum telemedicine dengan demikian untuk kedepannya? Silakan, Mas.
Ya, terima kasih. Tadi sudah saya jawab online, jadi namanya kurikulum menurut saya tidak menunggu pandemi. Jadi kurikulum itu harus kita selalu inovasi karena itu dinamis ya. Metode pembelajaran, desain pembelajaran, kurikulum, assessment, semua itu dinamis. Jadi menurut saya momen adanya pandemi ini bisa menjadi sarana kita untuk pembelajaran yang lebih baik. Tapi sebenarnya kita harus paham bahwa tanpa ada pandemi pun sebenarnya inovasi tadi harus ada. Nah, di kurikulum menurut saya karena ini sedang pandemi itu harus segera ada inovasi kurikulum di tahap tanggap pandemi dan nanti juga jangka panjangnya setelah pandemi. Jadi menurut saya sekarang ini memang saatnya momen untuk mulai memberikan inovasi tanggap pandemi. Jadi kurikulum keterampilan medis, Skislab, tim Skislab kumpul, kemudian men-setting lagi kurikulum pembelajaran mau seperti apa, ujiannya nanti mau seperti apa. Gitu. Jadi telemedicine juga menjadi suatu materi yang bisa disampaikan menurut saya, karena kan ini sekarang era industri 4.0, jadi telemedicine, terus konsultasi online, menggunakan mobile app, kemudian mengoptimalisasi medsos misalnya, itu mungkin kalau bisa untuk head promotion, kenapa tidak dimasukkan dalam kurikulum? Saya seperti itu sebaiknya tetap dimasukkan karena itu menanggapi perkembangan zaman ya. Jadi biar kurikulum kita tidak kuno, itu penting. Ya.
Baik, terima kasih Dr. Doni untuk jawabannya. Pertanyaan-pertanyaan yang lain sudah dijawab oleh Dr. Doni langsung PNE-Room. Untuk memang mengefisiensikan waktu, maka kita tidak menjawab semua pertanyaan melalui oral ya. Berikutnya pertanyaan kepada Dr. Nguyen. Next for Dr. Nguyen, can you please speak the question that you want to answer direct?
Okay, thank you, Emma. I received some question for me. For example, some attendees asked me when the student study skill, the student come to the university in limit number or just by virtual. At the moment we are now very lucky to control the COVID-19 because we have only 1,000. More than 1,000. So we now come to normal, new normal. and the student now come to study the skill at the university like normal. And the uh, the hospital now are open, but they get just a limited number of patients. So we don't have many patients for the student to practice in the clinical settings. And during the lockdown, not the lockdown, the university closed, so the student couldn't come to the university. But in the social distancing, that the student can come in to the university, but we limited the student working in group in 10, not in 20 or 30 as normal. So that's my answer for the question. Yeah, and the question from Dr. Hadian, that he or she asked about the difficulty for students to do the clinical examination because due to the limited models and mannequins, it's very expensive and it's not easy to access, and also the clinical setting is closed. So we also very worry about the quality of the training for this year, especially this year, and because the students don't have many opportunity to practice. So we open the skills lab at night from 6 to 8 p.m. Then the student can come to practice by themselves, not under the supervision. But I don't think that's the skill lab will open at night will last long because the staff in the skills lab is overloaded. So it's very hard years for us. So and we are working on the solution for this situation. Yeah, thank you. That's
okay. Van, how do you see the students' motivation in learning digitally compared to traditional learning? Do you have any evidence on that? Students' motivation.
Yeah, actually, I don't have I don't have time to do a formal study for that. But I asked the reaction from the student that I met during the teaching, and at first they like reluctant from the online study because they prefer the face to face. But the more they working online, the more they study online, the more they interact with the either by Zoom and breakout room. They said that they now welcome more with working online because they said that it saves time for them because they can stay at home and don't lose time for travel to the university, and they can study. The time is very flexible for them to study. Yes, but they still prefer the face to face. Yes.
Because learning from the experience of many colleagues, also from you, from your presentation previously, online learning was only used optimally during this pandemic, even though it has been built long before this. What is the optimal proportion based on your experience, online learning compared to face-to-face session?
For me,
yeah. Based on your experience, how many percent should we conduct online learning and how many percent is traditional one? Let's say that the pandemic is over. Do we still have to keep this online learning?
Yeah, in my experience and from my point of view, I think that after the pandemic, I myself conduct more online training, especially for the reasoning and diagnosis and like analysis the case, clinical case, because that's very convenient to conduct that online. But for the procedure or examination skills, I think that must be performs in mannequin or in SP or in real patient. And I think the student now they are now familiar with the online course, so I think they also welcome the online course. But our challenge is our staff, our teacher. They still think that working online is more like workload, yeah, than the face to face. But I think that's if you have time to like produce the materials and you give it online, and that will reduce the time for the teacher. I think so. But because they now have to learn themselves many new techniques, so they can feel overloaded. But I think that with the time they will prefer the online course.
Yeah, it's all about the rhythm, right?
Yes, it is. Yes.
Okay, thank you, Dr. Mayan. And Mr. Mendes, you have some questions in the Q&A room. Have you checked your questions?
Yes, I checked two.
Please answer the question.
I will answer to Professor Arjen regarding that if we can create clinical scenario by ourselves or change the existing scenario. We have these two possibilities. We have the possibility to customize an existing clinical scenario based on changing the priorities of the debriefing, putting, for example, the capillary refill time. If it is a first priority, put a non-relevant, or if it is, for example, a chest X-ray, it is not relevant and I can put you also as a first priority. But on the other way, we can also have an authoring tool that allows the teacher to create their own clinical scenarios from the scratch. So if you have an idea, you can create a clinical scenario, and after you create a clinical scenario, between 1 week and 2 weeks, the scenario will be available for be played on the software. On the software integrating on the body track, because previously we can play it as a graphic bar, just in order to check the coherence of the scenario. I have another question from Professor Drenia. I don't know if I'm spelling correctly the names, but I'm
That's
doing
all
my
right.
best. It is regarding if it is a Bahasa version. Unfortunately, we have 8 different core languages, but we don't have Bahasa. Obstacles to use. There's no obstacles to use because you can use it in a web browser with Mac computer or Windows computer. You can install offline or in Windows computer, Mac computers, but you can also install offline in Apple devices and also Android devices. So it is very easy to use it. Regarding the training and the mentoring, we have it. Every time that the institution wants to go forward with the subscription, we schedule many different training sessions in order to prepare all the teachers, because we never do training sessions to the students, but we give to the teachers, and regarding the software, how it works, the simulator, but also regarding the learning management system, how they will program the sessions, the training sessions, the evaluation sessions, how they will track the students. Because on the Body Interact, you also have the possibility to make distance learning evaluations, because we also have a tool that you can also create your own OSCEs, and you can apply your own OSCE in each simulation evaluation session that you would like to make. I know that all of us in here in this room, that we are almost 300, we would like to quit the pandemic, and with no doubt. Let me share also another picture that gives you the idea about how you can also work the Body Interact after the pandemic. After the online learning, how you can also use it. For example, here you can see that is a man here that is touching a Body Interact system there, and there's 3 teachers that are evaluating these students. And here, if you see, it is a real patient. It is not a mannequin, it's a real patient. So it means that every time, this is a kind of hybrid simulation. a integration simulation. That is the real world with the real patient, that they can address the questions to the real patient, and the real patient will answer them. But every time that they would like to request a test, every time that they will request, for example, an exam, give a medication, the algorithm of the body interact will play and will show the vital signs, the different exams, and so on. So after this pandemic period, it will be also useful to use and to combine the two best ways to learn around the world, that it is the physical simulation with mannequins and test trainers and the virtual simulation with the body interact. It is just only to share the idea about how you can also rentabilize the way to teach also after the pandemic, also using the body interact possibility to increase the knowledge of the students and give them also the possibility to have access to all the same patients if they are not allowed to go to the hospitals, for example. Because when we go to the hospital, it is very difficult to have access, for example, for pediatric patients. And here on Body Interact, all the people can have access to pediatric patients. This is an example. Thank you very much for the questions.
Yeah. Mr. Mendes, of course, the participants would like also to know the price of the set, just roughly.
Yes. We have 4 different plans. We have the light plan, the basic plan, the advanced plan, and the premium plan. Each plan have a specific number of clinical scenarios per area. The light plan allows you to select one content package with 10 virtual patients, and this one content package includes one area. The second plan includes to have the possibility to use 30 virtual patients in 3 different areas. The standard package includes the possibility to have the standard package with 50 virtual patients in 5 different areas, and the last one, the premium package, it is the best. It allows you to have up to 70 virtual patients in 7 different areas.
But no price whatsoever.
Yes. It can start around around $10,000 per year, and it will always increase. We also have special package, for example, by $5,000. We can combine the different options that the customer would like to have, because we have different package. I will show you right now what are the package that we have it, because we have specific package for specific customers. That, for example, the fundamentals of medicine 1, 2, the fundamentals of nursing 3 different package with each one clinical scenario inside. The cardiovascular, the respiratory, the nervous system, the general internal medicine, the trauma, the pediatrics, the pregnancy, for the emergency departments, for the emergency medical technician and emergency medical services, for the paramedics, for the ambulance transportation, for the future healthcare professionals. We have many clinical scenarios, many different packages that we can combine, and we can give a very good experience. Also, we have in our team also instructional designers, and also with Java Medica, we can also design the better learning experience according to the learning objectives of the institution, select the best clinical scenarios to work according to the competencies that they would like to work during a semester, during a year, and so on.
Okay, thank you, Mr. Mendes, for your thorough information.
Thank you very much.
Bapak dan Ibu yang kami hormati, demikianlah seminar kita pada hari ini. Sebagai closing remark, dapat saya simpulkan bahwa kondisi pandemi ini hendaknya tidak menjadi hambatan bagi kita untuk tetap belajar, berlatih, mengajar, dan melatih. Kondisi ini justru akan lebih membuka peluang untuk hadirnya berbagai inovasi dan kreativitas. Dari sisi mahasiswa dan trainee, kondisi ini justru melatih kemandirian dan kemampuan self-centered mereka sebagai tenaga medis kita memiliki sumber daya yang sebagai tenaga pendidik, maksud saya kita memiliki sumber daya yang cukup sebenarnya, kita hanya perlu berimprovisasi dan cepat beradaptasi dengan perubahan. Dan bukankah itu merupakan inti dari kemampuan belajar sepanjang hayat, lifelong learning yang senantiasa kita kampanyekan. Tautan untuk daftar hadir sudah dapat Bapak dan Ibu akses pada chat room, silakan mengisinya. Nanti sertifikat akan langsung dapat dikirimkan via email Bapak dan Ibu sekalian. Kami mohon maaf bila ada kesalahan dan kekurangan dalam penyelenggaraan seminar ini. Kami sangat senang dan sangat menghargai kehadiran Bapak dan Ibu sekalian pada kegiatan sore ini. Kami juga mengundang Bapak dan Ibu untuk seminar-seminar kami selanjutnya. Terima kasih juga kami sampaikan kepada IQ untuk dukungannya dan tentunya kepada sponsor kami Body Interact Incorporation dan Java Medica sebagai distributor produk Body Interact. Semoga kita dapat bertemu kembali pada kesempatan-kesempatan berikutnya. Akhir kata, billahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Selamat sore and good evening. And for all the panelists, the committee has sent you a link to a Zoom page. You can click on that and we can have an evaluation for the session this afternoon. Thank you very much. Have a nice day and goodbye to you all.
Thank you. Goodbye.
Thank you very much.
Thank you.
Mas Dodi sudah terima tautan untuk ini di briefing?
Mohon maaf, belum.
Belum ya, sebentar saya ini ya. Sepertinya ini ya. Ya ada di chat untuk panelis. Silakan Mas.
Oh ya, oke.
Iya, kita leave dulu meeting yang ini, nanti kita masuk ke Zoom meeting berikutnya.
Tinggal briefing, tapi kok nggak bisa ya? Halo.
Dr. Doni? Halo Dr. Doni?
Ya,
Dok, di kolom chat itu kita
copy
kirimkan.
Bapak linknya, di copy.
Iya, di copy aja dok.
Oh.
Yang linknya itu aja.
Ya, ya.
Jadi yang ini di lift dulu, kemudian ke kolom buka baru.